Hi, Dr. Ogosa here, and I'm here to make some clarifications about one or two videos I posted on my page where I said I was in the lab, I was posted to the lab, and people were saying, why am I doing the medical laboratory scientist work? Doctors don't work in the lab and all of that. Well, what we do in the side lab is point of care tests or bedside investigations. So basically, point of care tests are tests that are done outside the laboratory. It can be done by any healthcare professional or by the patients themselves. So it is not usually done by the med lab scientist or the laboratory staff. The advantages of point of care tests and why we do them is because it makes diagnosis faster and quicker and reduces the turnaround time for investigations. It's also cheaper and it reduces patient stay. It helps in making diagnoses like DKA because you do urinalysis and you see ketones in urine. You do the blood glucose check using glucometer and it helps you check that the patient is having elevated glucose levels plus the ketones you see on urinalysis. Also, a pregnant woman comes with hypertension, you do urinalysis, you are seeing protein in urine. That can help you know that this is a suspected case of preeclampsia. Another scenario, pregnant woman comes at night. She has to go in for an emergency cesarean section. Where do you get the urgent PCV that helps you know the blood level before you go for the surgery? In the side lab, how do you know the serology before you operate on that patient, the HIV status, hepatitis B status, hepatitis C status? It's by doing it in the side lab or by the patient's bedside. Since the lab is the issue, by the patient's bedside, it's just that doing it in the lab setting, so to speak, makes it more organized for us than doing it at the patient's bedside, and it helps us keep track of the investigations. And also somebody has to be there so that the person that is in that lab is designated to do those investigations and makes it faster than having to see your patient doing it yourself. It makes it slower. Do you understand? A patient comes, we are in a malaria endemic zone, and you want to check if the person has malaria. You're going to do a rapid diagnostic test. It's called rapid diagnostic test for a reason. We are still going to send MP to the microbiologist to check for us, but how do we get it urgently? It's by doing it at the patient's bedside. A patient comes, you urgently need to know if she's pregnant. How do you know in the side lab? It's by doing an urgent PT. So this is the reason why we have a side lab. It is not that we are trying to take the med lab scientists' work. It is because these things help us make quicker diagnosis and it's better in treatment outcome for the patients. And it is very important to know that it is not as if we don't send samples to the lab. We still send samples to the lab. We do the urgent PCV, but we'll still send full blood counts to the lab for them to help us check and compare with what we got. So I hope I've been able to convince you and not confuse you that doctors are not doing the work of med lab scientists. We are actually doing point of care testing or bedside investigations. It is just that we are doing it in a more organized setting. So that's why we call it side lab. Thank you. Bye.